Congressional Democrats are already fuming as the Trump administration pushes low-cost Obamacare alternative health care plans. Let's bring in Fox News medical correspondent Dr. Mark Siegel to explain what exactly the Trump administration is doing here and why.
First of all, they're recognizing that there's a problem. The problem is that, for example, a 30-year-old under a bronze plan this year, 2018, is averaging $400 a month in premiums. A 30-year-old. Many of them can't pay $400 a month. A 50-year-old is averaging $600 a month. Then you get into the doctor's office, Sandra, and a bronze plan is $8,000 deductible, so you're not even getting any real coverage. These are for the unsubsidized patients in Obamacare on the exchanges. So the Trump administration is saying, okay, we're getting rid of the individual mandate. Why don't we provide some alternatives, skinny plans they're called, where it's more of an a la carte menu, where you get more choices, where you actually get the health care that you may actually need, the coverage you need for yourself, depending on how healthy you are, depending on what your underlying condition is, rather than 10 essential benefits, which covers everybody else. And again, 5% of Americans use 50% of the health care. So the ultra-sick are being covered by healthy young people.
It sounds like, as a medical professional, you're a big fan of this. What you're hearing so far that's being proposed by the Trump administration.
Because I like choice.
Because you have choice, increases competition, and overall could bring down prices. I've heard you talk about this.
Decreases premiums, yes.
Democrats are not happy about this. This is what Nancy Pelosi has to say about this. Americans purchasing these shoddy, misleading short-term Trump care plans will be one diagnosis away from disaster, discovering they have been paying for coverage that may not cover basic care, such as cancer treatment, preventative care, or maternity care. Your response?
Well, first of all, we're talking about 12 months here. So this is a proposal that's going to be gap insurance. I would call this gap insurance. And I'm most interested in coverage for things like catastrophic problems, like if you suddenly had a heart attack or if you suddenly got in a car accident, you could end up bankrupt. That's a point that the Democrats have made that I've always agreed with. We need everybody in the country covered for catastrophic. But when she's talking about things like cancer care, that's a great word to use, cancer care, but the latest treatments for cancer care are $400,000 for a one-time treatment. Some new technology like CAR-T, no insurance is going to cover this. So there's a problem already with trying to cover the new technologies. Obamacare is not doing it. So I think we need scaled back insurance as a baseline that everybody buys into the system, rather than a lot of people saying, I'm going to take the penalty because I can't afford those premiums.
Really interesting stuff. All right. Developing story. We'll see where this goes.
Evolving, yes.
Yeah, evolving for sure. Dr. Siegel, thank you. Great.